Okay, last month has been very heavy with everything about endometriosis because it was endometriosis awareness month, and this month is Caesarean awareness month. So let's do everything obstetrics. So we're going to change the whole mood here and the whole team here. We are dealing with women with a lot of illnesses in the past 1 month and 2 months, and now we're just dealing with very healthy women who still need to see a gynecologist or obstetricians, and still is a medical condition, but to a very healthy bunch of women. So we are not going to deal with normality this time. Okay, the last few months, everything about endometriosis, everything is about disease and ill health, but this month is all about healthy women. We are going to deal with healthy women and issues involving healthy women. So it's all about birth. So I'm not just going to talk about cesarean, I'm just going to talk about everything about birth, so including natural birth as well. So yeah. So before I continue, so let's just a reminder to all of you. So if you have missed any of my videos, actually I have many videos before this. You can always still go to my YouTube channel at Dr. Tan City Clinic, subscribe to my YouTube channel, and click onto the notification button so that you will get all the new videos that were coming up. And as for today, anything you want to ask about birth, it doesn't matter, natural birth, cesarean birth, just put it in the comment section. Okay, just put it in the comment section, anything you want to know about birth. All right, so before I start, let's do something simple. Okay, as all of us know, we have two types of birth. We have natural birth, we have cesarean birth, and both of these is very different. Okay, one is natural, as in everything, you don't need to do anything, the baby just comes out on its own, everything is very natural. And when it comes to cesarean birth, it involves a surgery, and this surgery is considered a major surgery. So before I go on further with more info, I just roughly want to let you know there are actually differences between natural and cesarean. There are pros and cons both sides. I have to make it clear, I am not saying that there is one birth better than the other. I'm not saying that there is one birth that makes a mother more special than the other. No, every mother in this world is special. Every mother who gave birth to a baby has gone through a lot of sufferings, and that is a fact. So what is the difference? Natural birth and cesarean, what is the difference? Some women, they can't decide what they want. There are many reasons why certain people will prefer natural, certain people will prefer cesarean, and there are also many women who can't actually decide what they want. Okay, so I'm just roughly going to tell you the pros and cons of both sides. Okay, natural birth, we always say that it is natural. It is as good as you going to toilet, to pee, to poo. It is a natural process that happens to everyone. You know, it's like you eating, drinking, crying, passing urine, passing motion. All this is in a way a natural process. So natural birth is supposed to be a natural process. Whereas cesarean, of course, is not. It is a major surgery, and mind you, it's a major surgery. Some people have the wrong impression that cesarean section is very simple. Just lie down, plan a date, go to hospital, lie down, doctor do everything, and that's over. But honestly, it is a major surgery. In fact, it is also categorized as a major 3 in our surgery categories that we have as doctors. So it is a major surgery. Okay, pros and cons. We want to talk about life and death first, and all the other side effects of both sides of birth. Okay, life and death, it is a very simple concept. Natural birth is safer for mother, because for mother, as I said, it is a natural process. It's like you going to the toilet, to pee, to poo. So it is definitely safer for mother. It is nothing extraordinary. It's just a very normal process. Okay, but cesarean, it is safer for baby. Now I'm trying to say it's life and death, because in natural birth, when the baby needs to come out, things can happen. You know, you can be baby can be deprived of oxygen, and as a result can be life-threatening to the baby. But in Caesar, because we make a cut, and sometimes we can make even a bigger cut if we think it's going to be difficult to come out, and then the baby can just come out easily. So you see, for the baby, Caesarean is less traumatic, but when it comes to natural birth, it can be a bit traumatic to baby because the baby is being squeezed out, and in the means of squeezing out, oxygen can be deprived, and therefore there can be more life and death complication to baby. That's why sometimes we do see situations whereby you read in a newspaper the baby was admitted to a certain hospital, and subsequently because of lack of oxygen and the baby actually died. But in natural birth, that is in natural birth, but in cesarean we don't usually see that, unless it is also a natural birth with complication and they rush for a Caesar, but unfortunately they didn't do the Caesar in time and they lose the baby, but actually the problem was still because they tried the natural birth. But for mother, natural birth is just a normal process, but when it comes to cesarean, it is a major surgery, and as a result, when you have a cesarean, mother's life is at risk because number one, anesthesia is applied, and depending on what type of anesthesia, those days we use a lot of general anesthesia where we put the mother to sleep, and that is actually quite risky for mothers, and we do have mothers who die of after cesarean birth as a complication of anesthesia, and that is possible. And another thing is there's definitely more bleeding with cesarean, because when we cut, we don't just cut one layer, we cut a total of 7 layers. And when we cut the uterus, especially when we cut the uterus, you must understand throughout the 9 months is filled with so much blood vessel and so much blood, because we need the blood to go to the baby to give baby all the oxygen and the nutrient the baby needs, and as a result there can be a lot of bleeding. And also cesarean is also linked with a lot of clotting problems. I'm not sure whether you hear about all these clotting things recently. Blood clotting got to do with one of the COVID-19 vaccine that has been highlighted, but honestly in cesarean birth it happens even more than going for a COVID vaccine. That's why sometimes when you look at the numbers that people are portraying, sometimes you must look at what are the actual numbers, and you will realize that actually going to give birth is actually a lot more riskier than actually going for a COVID-19 vaccination. Okay, so if any of you have not registered, please register. Yeah, just for your information, I have just completed both my doses of COVID-19 vaccination, and I'm well and fine. Okay, all right, so going back to birth, so we also worry about blood clotting complication that can happen with cesarean birth. That is why sometimes you see nowadays there is a trend. It is not a must, but it is a trend. You do see a lot of women after cesarean actually getting this blood thinning injection. That is because this blood thinning injection to prevent the blood from clotting after a cesarean. Women also do get blood thinning injection after they are admitted to Hospital Sungai Buloh for COVID-19, because COVID-19 infection itself also causes blood clotting. Pregnancy itself, it is a situation where it tends to clot the blood, and then having a cesarean makes your risk a lot higher. Okay, so that when it comes to life and death, so as I say, natural birth is always safer for mother, and cesarean birth is always safer for baby. And then when you compare like this, how are you to choose? In general, we always prioritize mother's life more than baby's life. That is why we usually encourage natural birth to cesarean section. And if it's taken care properly, most of the time baby should be well. Okay, but of course it's not 100% all the time that if taken care properly, that baby will be well. So that's why when we choose natural birth, there is a slight risk on the baby. So sometimes how to decide? So it also depends on situations whereby, like if the mother gets pregnant very easily. So in these type of situations, we always feel that the mother's life is more important. But there are situations where the couple get pregnant very difficult. Maybe they waited 10 years, 20 years before they got the very first baby. So when you waited so long, sometimes the baby's life is like a little bit more precious, because I'm not saying if you get pregnant easy, your baby is less precious. By right, every baby should be precious. But in this type of cases, we are a bit more worried if they go for natural pregnancy, natural birth, and just in case something happened to the baby and the couple cannot conceive anymore, this is their one and only baby. So it can be a decision-making condition where some people will feel that I better don't take the risk on my baby. I just go for the cesarean. I just risk it on myself. And in fact, I do have mothers who tell me that, because in cases where mothers waited so long to get pregnant, I usually tell them this risk on both sides, and I leave it to them to decide. Majority of mothers will still prefer to go for natural birth, but there will be a small minority of mothers who just tell me that I'm not a risk taker, I do not want to risk my baby's life, and I would choose a cesarean. So there's no right or wrong. Honestly, I feel it is all mother's preference. Okay, so that is when we talk about life and death. But we also cannot just look at life and death. We also need to look at side effects. Are there side effects of natural birth? Are there side effects of cesarean? Okay, all these things may not cause your life and death danger, but it does cause you discomfort and also maybe sufferings for the rest of your life because of the side effects. So what are those? Both sides has its own side effects, yeah? Natural birth is a we always talk about urine incontinence, we talk about uterine prolapse, and these are very much linked to natural birth, the number of babies you birth, the easy birth, difficult birth, the size of your baby, whether you ended up with a vacuum delivery, forceps delivery. All this can be linked to a little bit more side effects on the mother, whereby the mother may end up with urine incontinence or even some fecal incontinence, and also uterus prolapse after that. And all these things can be long-standing up to old age. Yeah. All right. So even though natural birth is safer for mother, but mother do have certain side effects from natural birth. For cesarean section, we say that cesarean section is safer for baby, but there are side effects for baby as well, because we know that in cesarean birth, there is higher chance of baby developing lung problems like asthma, allergy, and more numbers of baby after cesarean birth ends up in the incubator and ICU compared to natural birth. So these are the disadvantage side effects of cesarean section. Some of you may ask, why cesarean baby end up more in ICU and incubator and need help in ventilation? The reason is simple. It's because when you have natural birth, the birth itself involves a lot of hormones and chemicals being released by the mother, and as a result, the baby gets prepared to be born. So the baby actually matures because of the process of labor. But when you choose a cesarean, especially when you choose a cesarean, if you have natural birth and end up with Caesar, it's fine. The baby still gets this signal that baby needs to come out and needs to mature. But if you choose to Caesar a baby, like you choose a date and you decide to have a Caesar even without any signs of labor, actually all these processes to mature the baby may not start yet. And as a result, babies come out a bit more premature, even though the dates have arrived. I had one case I still remember. Her baby was very, very big. And usually for very, very big babies, I naturally advise them to induce the baby earlier before it's too big so that it can still come out. But because she was waiting for her confinement lady, and the confinement lady is still so busy and cannot, so she kept waiting until after her due date. And when after her due date, her baby was really very big, and the mother said, it's so big, I just want to go and do a Caesar, I don't want to try anymore. And when the baby came out very big and past the due date, but still the baby ended up in the ICU, in ventilation and incubator. So it doesn't matter how big your baby, and it doesn't even matter when you give birth to the baby. by cesarean, the risk of baby lung not maturing is actually higher. So that is why cesarean has some side effects for the baby. And on top of that, for the asthma and allergy, is because of the probiotics, because mother vagina has a lot of good bacteria and a lot of good stuff there to protect the baby. But when you deliver by cesarean, you miss that, so the baby is not born with all this protection. As a result, the baby lack all this probiotic protecting the baby from illnesses, allergy and asthma. So I have also seen one mother, she had a Caesar, and then when she came to me the next time, and she said she very much do not want a Caesar anymore. And when I asked her why, it's because the baby had asthma, and a very bad asthma in fact, and she doesn't want her baby to get asthma this time. And you think about it, if your baby is born with slightly premature lungs and in ICU, and plus the fact that your baby did not have any of all these probiotics in the body, and of course with that, your baby's chance of developing asthma will be even higher. Okay, so these are the pros and cons of natural and cesarean birth. So I always believe that every mother should know what are the pros and cons both sides, and choose for yourself what you think is best for yourself. Okay, there is no such thing as one birth is better than the other. It very much depends on what you want and what you don't want. So you see, now you know the pros and cons. You also need to understand the entire process. The entire process of birth also can determine which one you prefer. Natural birth, people always talk about pain. We always talk about pain. And in fact, there are a lot of mothers who say, I prefer Caesar because I'm scared of pain. And that to me is a myth, it's not the truth. Because don't ever choose Caesar because of pain. Because natural birth, you can have pain-free birth. You can have very comfortable birth. But cesarean is definitely going to be painful after that. So when people who are very scared of pain, I tell them it's very simple. You can always go for epidural. And when you have an epidural, you have no pain. Then when they say, epidural, I heard it's no good. But I told them, why is it no good? Because there's an injection on your back. But if you go for Caesar, that's what you're getting anyway. So when you go for cesarean, which means that you have already decided you want the injection on the back, then might as well take the injection and go for natural birth. Because if you have epidural with natural birth, after the birth, you're well and fine. You can walk, you can run, you can jump, and it's pain-free. But after cesarean, after the anesthesia is over, you are still going to be in a lot of pain. And many women can't even get down of the bed on the first one day because it's so painful they cannot even get down. So if you're really scared of pain, you shouldn't opt for cesarean. You should opt for natural birth with epidural. Okay, then you have no pain. So then you don't need to worry about pain at all. So natural birth, you need to know the process. Many people, they go and give birth, they don't know about the process. A lot of times when they ask their mother, how is giving birth? Some mothers will say, you don't need to know anything. When the time comes, you know what to do. A lot of older mothers, they're like very taboo. They do not want to tell much about childbirth. Actually, that's not so good. I think you should know what is going on. So you must know what is going on with natural birth. That is when a childbirth class is very important, because when you attend childbirth class, you will know the entire process of how a baby is born. And so you need to ask yourself, when you know everything about natural birth, is that what you want to go through? Then after that, you also need to know what is cesarean. A lot of people say that a cesarean is very easy. Just lie down, doctor do everything, and that's over. But they don't know that what could happen. What could happen? What are the things that people don't like in natural birth, and what are the things people don't like in cesarean? Of course, this don't like is very individual, but these are the things that I often hear why women don't want to go for natural birth, or why women don't want to go for cesarean. So let's see, for example, natural birth. What are the common things that women don't like natural birth for? Number one, they don't like the vaginal examination. Who likes vaginal examination? I don't think anybody likes vaginal examination. But how much are you be able to accept a vaginal examination. So vaginal examination is something you need to go through in a natural birth. Okay, so, and most people don't like, but they can still accept. But occasionally, some women, they just don't like and they cannot accept. So when you don't like and you cannot accept, then it's a bit difficult, because we can minimize, but we cannot like no vaginal examination. It is not possible. So that is one thing you need to ask yourself, whether you can accept vaginal examination. And the another thing is, some people, they don't like the idea that somebody is going to cut them below there. But I think most of these women who don't like to be cut below, they also do not like cesarean, because that is even a bigger cut. Okay, but that is one thing that some women don't like. Some people, of course, they don't like the anticipation, you know, they don't like to don't know when the day to give birth, when will it come. Then always when these women say, I don't like this uncertainty as to when I'm going to give birth, or there are some women that still believe that choosing the right date for baby to born is very important, all these traditional beliefs, then I'll tell them, you don't need to go for a Caesar because of that. You can always induce your baby to be born as and when you want. Okay, so there are cases like that, because they just want to choose the date, or for some reason they have to give birth during that week and nothing else. You know, there's a lot of things that's planned out, the husband's schedule, her work schedule, her husband's work schedule. You know, sometimes some people does have all these things that contribute to their decision making. And also the actual birth itself, some people feel that this pushing baby out to them, when they look at it or they think about it, it's like it's something they cannot endure themselves doing it. I mean, as I say, it is individual, and of course there are some women who do not like the incontinence and the prolapse, and they will choose for a cesarean. Okay, so these are individual. Then for Caesar, is it so beautiful? Is it so nice as you just lie down, don't do anything? Unfortunately, it's not, because in cesarean, you must understand that number one, not all anesthesia work the same, because nowadays we don't let you sleep anymore. We don't give you anesthesia that put you to sleep. If we put you on anesthesia, put you to sleep, there is still one thing that you always need to worry. Sometimes, because for anesthesia that put you to sleep, some anesthetists, they are very conservative in the amount of medication they're going to give you, because we know that full anesthesia for childbirth can be quite dangerous for mother. So they actually reduce the dose, and that can also cause a problem, because some of you can actually know what's happening during the entire cesarean and feel the entire thing, just that you are under anesthesia. So it is actually a very horrendous feeling, because I had one mother who had that, and what happens is that she could feel that people cut her and everything, all the pain she could feel, but she cannot move. She cannot move, she cannot talk, she cannot scream, she wants to fight back, she can't, because she's under anesthesia, but she felt everything. And I tell you, that is the biggest nightmare people can ever think about. If you ask me, the nightmare of that compared to the nightmare of childbirth pain, that is an even horrendous nightmare, because childbirth, even if how painful, you can scream, you can shout, you can move, you can fight it, but when you're under anesthesia, you totally cannot fight, and that is quite horrible. And let's say if you don't get the full anesthesia, like majority of women today do not get the full anesthesia, we get the half anesthesia. But even for half anesthesia, you have some women, they feel like the anesthesia is like not really working for them. So what happens is that they actually feel they can feel everything. They can feel the doctor cutting them, touching them, pushing them. You can feel that. I still remember my first baby, that's what happened. I was having a cesarean, and the anesthesia did not work so well on me. I still remember I could feel the doctor cut me, and it's quite horrible as well. Although I can't feel like 100%, I don't really feel 100% pain like as though being cut, but I do feel every single step of what the doctor did to me. And trust me, it's also horrible, because I know how to do Caesar, so I can imagine what the doctor is doing all the time. So it is quite horrible as well. And there are also a lot of women who can actually feel that So, and the anesthetist, I will say that he's very cruel, because he knows I can feel. I told him, but he didn't do anything, because normally, like in private, if you can feel, what would I do? The anesthetist will say, okay, it's not working, and the obstetrician will say, okay, let's stop for a while, and the anesthetist will probably give me more medication or put me to sleep so that the obstetrician can continue with the surgery in peace. But in my situation, no, my anesthetist just kept talking to me. He used talk therapy. He just kept talking to me. He must be someone who can keep talking. So he just kept talking and talking and talking and talking. And you know, cesarean can finish in less than half an hour. So he talked to me for half an hour and that's it, over. Oh my God, that was a very bad experience to me when I had my first cesarean. And the other way around, you can have extreme effects on the anesthesia, whereby you have it a bit overload. Women who have a bit overload, they also feel very bad. They feel good in a sense that they don't feel anything at all now. They're totally numb. Whatever the doctor does, they don't feel anything at all. But they feel very sick. They feel like vomiting. They feel so dizzy. They feel they cannot breathe well. They have difficulty trying to breathe. They feel trembling all the time, very cold. So this is when the anesthesia is a bit overdone. And that can happen as well. And these women actually feel very, very sick throughout the entire cesarean section. And last of all, I always say a lot of women are being conned to do Caesar. You know, they're conned because there are women who love Caesar. I tell you, there are women who love Caesar. And I respect them for their choices. They love the Caesar, they can cope well, and they are okay. But the problem is they go around telling people. That Caesar is no pain one. They give you anesthesia, you don't feel anything. When you wake up, you're good, you can walk, you can do everything. For me, after Caesar, 2 hours, I'm down walking, or 4 to 6 hours, she can walk. She don't feel any pain, she's very well. All these women actually con people one. I mean, they can cope well, I believe. But to say that to someone else, because I had one lady who thought that way. She was told by her friend that cesarean is so nice and easy, and then she chose for the cesarean, and guess what happened? She's the one who got a bit under anesthesia during her anesthetic, so she could feel the whole cesarean. She was like, why did my friend told me can't feel anything and I can feel something? So she could feel it, so it's already a bad experience for her. And then after birth, the next day when I saw her, she said, doctor, so pain, I cannot walk. Why my friend no pain? Do you think your friend has no pain? It doesn't make sense. It is a major operation. We cut 7 layers. How could your friend have no pain? So it's not that they have no pain, but they have mentally conditioned themselves to go for it, and they have mentally conditioned themselves that birth is no pain. So because of that, birth is no pain. So, but she did not mentally condition herself. She thought it's definitely no pain. No, after Caesar is actually very painful. So that is why they get conned. So these are the things you have to anticipate. In cesarean, after giving birth, you can't get down on the bed for at least overnight until the next day before we take out everything. So there are some women who don't like that because we have a drip on, and they don't like the drip, and they also don't like the catheter in the bladder because it's so painful. We don't want you to come down and walk. You can't walk, it's so painful. So we put a catheter so that you don't need to go toilet. Actually, we put the catheter so that you don't need to go toilet. But some women just don't like that catheter inside, the urine tract. So they just dislike it so much. So these are the things that women go through for both natural birth and cesarean, that you must really think what you want to go through. So before you make a decision whether you want to go for natural birth or cesarean, first you need to know the pros and cons. Pros and cons, think about it. And then choose the path knowing what is the pros and cons. So don't after something happen and then you say, why this thing happened? Well, when you walk that path, this is something that may happen, you see. So you need to know that. And then you must know what you have to go through. So you must ask yourself, is this what I want to do? No? Is this what I want to go through? Go into the labor ward, with my husband next to me, lying on the bed, waiting for birth, waiting for the contraction pain. Going through the contraction pain for hours and hours and maybe days. Is that what I want? Or I prefer to go to an operating room. It's an operating room. Operating rooms are very cold, and I'll be alone half the time, because most of the time we don't allow the husband the whole time. We usually let the wife goes in first. After everything is prepared and about to start, only we let the husband go in. Am I okay to be there alone with the anesthetist, with my doctor, with my nurse? And then what if my husband doesn't want to go in? Because not all husbands go for Caesarean birth. Or maybe my hospital do not allow my husband to go in. These are things you have to think. And then when I go and do the surgery, if I can feel, how am I okay? If I can feel, these are things I have to think. And then after Caesar, it's so painful, but I still need to walk. Am I okay? You have to know what you are going through before you actually make your decision. Before you actually make your decision, do I want this or that? So these are the things that you need to be aware. So you go and look at videos. There are a lot of videos, but sometimes I feel all these birth videos are not painting the real picture, because they always show you very nice videos. When they post up videos, it tend to be beautiful births. So the natural birth one also not really that painful, and then birth quite easily, and the cesarean one seem to be still giggling and smiling during the Caesar, but in real life, that's not real life lah. It happens to some people, I agree. A small percentage of people does have a very nice birth that looks perfect for YouTube videos, but the majority of women, no. Whether natural or Caesar, the birth, they don't look so beautiful, the videos. I'm not saying that their birth is no good, but the birth can be good quality birth, but videos doesn't always look that good, okay? Alright, so so that's all I've got to say for today, and I want to go through some of the questions that were posted up to me earlier. So there are some questions that were posted up to me earlier, because I did put a post earlier on to ask for questions, and I did get some questions. Okay, let's see what are the questions that I got. Alright, straight away when I post up, the first thing that everybody asked was about scar rupture. Okay, scar rupture, which is something I didn't mention. If you have a cesarean, one of the things that can happen, because just now I was only talking about the pros and cons of this birth, but we also need to think about what happens with my next birth. Okay, so this is something I often mention in many of my antenatal talks. First birth, everyone has a certain risk, because we do not know whether you are easy birther, difficult birther. So you have a certain risk. But if, let's say, first birth you ended up with natural birth, each and every pregnancy your risk goes down. Each and any pregnancy your risk goes down. But let's say if you have a cesarean in your first birth, then the next pregnancy your risk actually goes up. Why? Because if you choose for cesarean, we worry about cesarean scar. If you choose for natural birth in your next pregnancy, we worry about cesarean scar rupture. That means your scar open up the next time you try to give birth naturally. But this risk is only about 0.7 to 1%. It's less than 1%. But let's say you choose for cesarean the next time, or some reason doctors say you cannot go for natural the next time, so you choose for cesarean the next time. But when you choose cesarean the next time, your risk actually goes up. If you keep doing Caesar, your risk keep going up every pregnancy. And that is why we have a limit for cesarean birth. We cannot have too many cesarean birth. After a certain limit, 3 or 4, you must stop. Why? Because your risk keeps going up. We even have a Guinness World Record of how many Caesar a woman can do. Even if you don't want to stop, there will be one day you just can't do it anymore. Because that's why there is a Guinness World of Record for that. Because there are risks involved. and complications. Complications go up with each pregnancy, and one pregnancy, when you have a big time complication, you will never be able to give birth anymore. So that's why there is a Guinness record. So each pregnancy goes up with Caesar. Okay, the second pregnancy, let's say your risk goes up because you want to try normal, but you successfully birth normally. Then subsequently all your pregnancy, your risk is still the same. It may come down slightly, but it is still the same. It doesn't really come down a lot. So that is why we always talk about scar rupture, uterus rupture, if you want to try normal in your next pregnancy. General rule of thumb in most situations, we always say that if you have natural birth one time, if you have cesarean one time, you can always still try natural the next time. But if you have cesarean 2 times, then you should not try natural anymore. You should always do Caesar already, because the chances of a scar rupture doubles after 2 times cesarean if you want to try natural again. So that is the general rule, okay? So Cantine, her name is very interesting. Her name is Chantek Beauty. So Chantek Beauty asks about uterus rupture during VBAC. So VBAC is vaginal birth after cesarean. VBAC. VBAC is vaginal birth after cesarean. So in vaginal birth after cesarean, we have this risk, we worry about scar rupture. So that's why everyone who have a Caesar, if you want to try normal the next pregnancy, we have to assess back why you Caesar, what condition, what happened after, any complication, and then only we can say whether you can try normal or not this time. So it's not like everyone who had cesarean definitely can try normal the next time. No. So we have to look at certain situations, like when you had the Caesar the last time, was it at full term, or was it a premature baby? Premature baby has a higher risk of scar rupture. Another thing is, how was your Caesar done? Was it a horizontal? Was it a straight line? A straight line, higher risk of scar rupture. And also, we want to know if the doctor have any difficulty trying to get your baby out during the cesarean, because although we cut horizontal, but when we have difficulty, we always extend upwards. So we have we call a J-shaped cut. And when we have a J-shaped cut, the line that goes straight up also increases your chances of a scar rupture the next time. So you need to know all these things. And last of all, we also want to know, after that, was your wound good? Was your wound badly infected? Because a badly infected wound is usually not a very healthy wound. And because it's not a very healthy wound, it also tends to break up easily. And last of all, there is a special scan that we can do before you are pregnant to look at the presence of a isthmocele, or I call a niche. So this is something you can also look up. I have one video a couple months back. Go to my YouTube channel, yeah. Look for my video on isthmocele or niche. It's actually a gap in the Caesar scar. So if you have a gap in the Caesar scar, also we know that your chances of scar rupture is a bit higher. And also another thing is, we can also measure your scar thickness during pregnancy to know whether your risk of scar rupture is higher or not. But all these things, is just a guide. There is no like 100% in what situation must have. So we look at the whole thing as a whole. Do you just have one thing, or what is the factor that you have? Is it a very big factor that can cause like 50% chance of rupture, or is it a factor that causes maybe 3 to 5% chance? So we look at all these things and weigh and see whether or not you can be allowed to have a natural birth, can allow to have a vaginal birth after cesarean. So these are things that we look at. Okay, so and another thing we will do is regarding your birth itself. Your birth itself, if you are a VBAC, we have to be very careful. More monitoring, less use of medication. Just be very, very careful. So you need more monitoring. So sometimes, I have mothers who come and tell me, doctor, I cannot decide. I heard, I was told by my doctor, my other doctor, they like to come to me for second opinion. So they ask, my doctor say, if I try natural birth, I have this, what do you call that? Possibility of this complication. Because of my previous Caesar, maybe I will end up with this complication. If I try Caesar, then I may have this complication. And then doctor tell me like that, I so scared. Natural birth also I scared. Caesar also I scared. How, doctor? Normally my answer is very simple. Leave the worry to your doctor, not to you. Because the fact that your doctor gave you an option. So it's not that you cannot have natural birth. And it's not that you cannot have cesarean. No, the doctor asked her to choose. You want natural also can. You want Caesar also can. Complications of natural birth, Complication of cesarean, I said those are complications, ma. You cannot decide. You don't decide based on complication. Because both sides also got, ma. You have to decide what you want. You have to decide what you want. Leave the worry about the complication to the doctor. You want to try natural birth and your doctor allow you. Don't need to worry about scar rupture. Leave that to the doctor to worry. It's for the doctor to make sure your scar don't rupture. It's not for you to make sure your scar don't rupture. You want to try cesarean, but your doctor tell you that your wound look like there's a lot of adhesions. Maybe you may accidentally cut your bowel. Don't worry about that. If you think you like Caesar, go ahead. Cut the bowel is your doctor's job to make sure he don't cut your bowel and don't cut your bladder. It's not for you to worry. What can you worry? What can you do? You lie down, someone else is cutting on you. Doctors have a duty to inform you. Because in legal sense, we say that whatever we do, patient need to know about all the possible complications. So the patient is well informed and choose that decision. So doctor's duty need to inform you all the complications. Your duty is don't worry about complication. Think what you want. Is this what you want? Is this cesarean what you want? Is natural birth what you want? I know about the complication because my doctor told me. I prefer natural birth, then go for natural birth lah. If I prefer Caesar, then go for Caesar lah. The complication you know enough. Keep it at the back of your brain. Let your doctor worry. It's not for you to worry because there's nothing you can do to make sure it doesn't happen. Okay? So that's what I have to say about uterus rupture. Okay, next question. This question is from Jermaine. Jermaine Go. Jermaine Go asks, can cesarean birth worsen endometriosis, especially adhesions? So Jermaine Go asked this question because Jermaine Go has endometriosis and he's going for a cesarean, but he worried that the endometriosis adhesion will make worse because endometriosis has a lot of adhesions and Caesar also can have adhesions. Number one, you need to know, Caesars rarely have adhesion. Caesars very rarely have adhesion. It is a very rare thing. Endometriosis tend to have more adhesions, very common. Endometriosis and adhesion is very common. Caesar, very rare. So not something you should worry about. Okay, so it's not something you should worry about. But her next question is, can Caesar birth worsen her endometriosis? If it's just endometriosis, cesarean birth does not worsen your endometriosis. Okay? Getting pregnant is already protective for you. Nothing else could be worse. Okay, next question is Honey Lee asks, I've heard that baby's blood pressure going too low and rendering it necessary for cesarean, emergency cesarean. But what if baby's heartbeat went up to 200? Okay, it doesn't matter whether it's low or high. Whether it's low or high, it is also a sign of baby not feeling well. When the heartbeat it gets low, we always say that baby's heartbeat is weak. When the heartbeat goes high, it's still something happening to the baby. It's the same like we adults. When we are very scared, very anxious, very panicked, our heart rate go up. It's not just that, it's not just psychologically, but anything. When we are in a lot of pain, our heart rate go up. When we lose a lot of blood, our heart rate go up. When we go into heart failure, our heart rate go up. When we cannot breathe, our heart rate go up. So when baby's heart rate go up, something is happening to the baby. When we have a fever, high fever, our heart rate go up. So if the baby's heart rate gone up, something is happening to the baby. So usually, I don't like to call blanket rule. Blanket rule is for, junior doctors, nurses, no need to think so much. Heart rate go down, means baby not well, Caesar. Heart rate go up, baby not well, Caesar. And this is like, no need to use brain, okay? But as an obstetrician, or as an experienced obstetrician, you cannot do things like that one. It shows that you're not using your brain. Then what's the point of having an obstetrician? I might as well just have a midwife who knows when the heart rate go down, Caesar, heart rate go up, Caesar, right? No. So as an obstetrician, whenever the heart rate goes up or go down, the first thing he needs to do is not order for Caesar. He should ask himself why. He should ask himself first, why? Why the heart rate go up? Why the heart rate go down? Is then by knowing why, then you see what is the solution. Maybe I can do something else for the heart rate to come down. Let's say, for example, the heart rate go up because mother got fever. Mother fever, baby fever. So heart rate go up. Then next question, I want to know why the baby fever and the mother fever. Or maybe the mother having dengue fever, dengue fever, so the mother having fever. The baby also probably having fever because mother having fever. So in this sort of situation, I don't do a Caesar. I may not do a Caesar. Or maybe he's having fever because of a bad sore throat. So the mother fever, bad sore throat. So baby's heart rate go up because baby also having fever. Mother's heart rate go up because mother also having fever. So in this sort of situation, do I do a Caesar? No, I give Panadol. Right? I give Panadol, your fever come down, your heart rate come down, your baby's fever come down, your baby's heart rate also come down. So it's not necessary. Everything must go for Caesar. Same with heart rate go down. Heart rate go down, I also want to know why. Because one of the most common reasons for baby's heart rate go down is head compression. Head compression. And many of these cases, the story is so typical. A lot of these are cases. The heart rate come down, and then, typical people panic. Oh, heart rate come down, panic. Fast Caesar. They never think why the heart rate come down. But actually, the heart rate come down is because of head compression. Head compression very often means the baby is coming out soon. Because just before coming out, the passage is so tight, the head is being compressed. So instead of assessing and see whether the baby is coming out soon, they panic and then fast push the baby to do Caesar. But in this type of situation, what happens is that very often the mother actually gave birth in the operating room. We have seen so many. Heart rate come down, rush for Caesar, push the baby, reach the operating room, give birth at the corridor, I've seen, or push in all the way into the operating room. Then suddenly patient want to pass motion and just birth the baby in the operating room on the operating bed, and not Caesar. It's a natural birth. And many years ago, I saw one case, but that's not in Malaysia. It is a case that happened overseas. Oh dear, that is so scary. The heartbeat not good, so they quickly push the patient to go and do Caesar. And then after give anesthesia, the patient lie down. And then the doctor went and cut the tummy. And then when he cut the tummy open, where's the baby? the baby came down from below. While operating the baby, operating the Caesar, the mother gave birth to the baby already. Okay, you operate, you make a big hole on the tummy and then the baby come out from below. That is like, oh my God, that is like a horrible thing to have happened, actually happened. Poor mother, poor mother. And trust me, I also feel like saying poor doctor, okay. It can be very traumatic for both the mother and the doctor. But that is because they don't think. So that's why when you look at heartbeat up or down, you shouldn't like, heartbeat go up, Caesar, heartbeat go down, Caesar. No, think first. Why? Why? So it is not really that all heartbeat go up must Caesar. It also not really all heartbeat go down must Caesar. So all this you must always think. Yeah. So that's why I say, if the obstetrician is thinking, you can have a lot less cesarean. It's when they don't think, then only they have more cesarean. Okay. So sometimes also depends on where you give birth, because sometimes, like for example, if you're in a government hospital, for example, when a junior doctor sees the patient and call the obstetrician who is on duty, but in the middle of the night, and he's probably at home, and he never see the patient, and then over the phone, sometimes the stories that go through, may not be 100% of what is exactly happening, and the obstetrician just want to be on the safe side. Caesar is to be on the safe side because he's not there to assess, and if the heartbeat is so low, he may take another 15 minutes to reach the hospital. It's not safe to wait for him, so that is why they will just tell the doctor to Caesar. Sometimes these type of things can happen, or even in private, if the obstetrician is at home, and when they are being called that the heartbeat drop, and he knows it takes like 15 or 20 minutes to reach the hospital, and if he waits until he reaches the hospital to make the decision for Caesar, the anesthetist at home also need another 20 minutes to reach the hospital. Then with that delay, we worry about things that can happen. So sometimes on the safe side, we just say Caesar, and then we rush to the hospital together with the anesthetist. Everybody reach there in 20 minutes so that we can start. So sometimes certain situations like this do affect the decision, and that is why if it's head compression, you will see when we rush there and then we reach the hospital and the patient give birth already. Well, that is good news for the mother actually, but sometimes these type of decisions do happen in real life, because it's not easy to really know what is going on with the patient unless we are there looking at the patient. But we can't be there 24 hours a day. That is why sometimes we may be at home. That's why I always feel that the Malaysian system is not right. The Malaysian system is not right. We should have like some other country, like Australian system. In Australia, it's all group practice. It's all group practice. You don't decide who deliver for you. You go to this group, this clinic. This clinic has 5 doctors, 5 obstetricians. You don't get to choose. Each and every one of them go take turn to be on duty, and when they are on duty, they are really at the hospital taking care of you every single minute. They are not at home. They can do that because 5 of them, they take turn. So but in Malaysia, we always say if we go to private, we want that doctor to be taking care of us. And if that doctor is busy, he cannot be in a hospital 24 hours a day, 7 days a week, 365 days a year, right? So he has to go home. And this home thing, sometimes they don't know exactly what's happening to the patient in the labor room. So it's actually not the perfect system. But I do not know how this thing is going to change. It takes a lot to change, because when we want to do group practice, you will see a lot of patients don't want you. They want to go to someone that they can choose. Okay, so Eva was saying that government hospital is the best, but unfortunately it's also not the best, Eva, because even though you have doctors 24/7, but they are usually junior doctors. So again, the person who is taking care of you is not experienced enough, and the obstetrician sometimes is also at home. So again, it is a phone call. You ask me a phone call from a midwife in a private hospital or a phone call from a medical officer in a government hospital, no difference. Some of them are very reliable, some of them are not reliable. You get phone calls you cannot trust, you have to go there to decide. So that is why the system, whatever system we have in this country, is still not perfect. Not all government hospitals have obstetrician 24/7 in the hospital. Even if they have, it is the junior, the ones, those specialists that just pass out, you know. So it's also not the same. So we do not have the perfect system in Malaysia yet. Okay, I think time's up. As I always say, 1 hour is the most I will talk. Time's up. If you want to talk about birth, there's no end. Okay, so we will continue next week, yeah? Same day, same time. All your questions that you have posted up, I will keep them, and next week we will talk about it. And yeah, that's all for today. So for those of you who have missed some of the episodes on other aspects of birth, you can always go to my YouTube channel, Dr. Tan City Clinic, and please, yeah, subscribe to my YouTube channel, yeah? And for more, to answer all your questions that you have given today, and there's still one more question that was posted up earlier on, I will try and answer all of them next week. So see you again next week, same day, same time. Bye bye.